এটা থেকে যাবে এখানে গুড মর্নিং শুনতে পাচ্ছ আমাকে? Am I audible?
Yes, sir.
Good morning. Our today's discussion is dental products. Without wasting time, I am entering into the matter of discussion, that is dental products. Now, all of you have the general idea about our teeth and the anatomy of oral cavity, and it is also probably known to you that poor dental health, the poor dental health is a problem that is prevalent in the third world countries. And especially if we think about our country, India, the problem have been compounded by ignorance, poor literacy levels, diverse languages, diverse habits, different habits we have. We have the habit of chewing tobacco, pan masalas, and all these things aggravate the oral hygiene. And you know that India has the highest incidence of oral cancer in the world today. Along with it, the periodical gum diseases also strike at a fairly early age. That should not be, but at a very early age, we find that gum diseases, patients are coming with gum diseases. And the problem associated with bleeding of gums, loose teeth. So these are the problems due to not taking proper care, proper preventive measure. হ্যাঁ সহেলি কি বলো? জয়েন করতে পারোনি? জাস্ট a minute. জাস্ট a minute দাঁড়াও। আমাকে একজন বললো যে জয়েন করেছে, সে বলেই তো বললো নাকি? ও আচ্ছা, করে দিচ্ছি। সো অ্যাডমিটেড হয়েছে তোমরা 39?
হ্যাঁ স্যার।
হ্যাঁ স্যার।
ওকে, so it is clear to you that dental hygiene, it has been considered as important since long, and in order to maintain dental hygiene we have numerous dental products in the market. Now, what do you mean by these dental products? What are the functions of these dental products? Dental products, their function, in first very important function is the cleaning. Clean teeth gives you good health, and clean teeth cannot decay. If there is no decay, no caries, then other diseases of the teeth as well as in the large scale of the entire oral cavity can be removed. The possibility can be eliminated. Now, where the problem lies is that everybody nowadays know that cleaning of teeth is important for oral hygiene to eliminate many diseases. But the The problem lies in cleaning of the teeth all through the year. It is not easy to clean your teeth continuously throughout the year. A large number of inorganic chemicals and their preparations are known, which find application in the practice of dental and oral disorders. And as they come in contact with the human body, they are regarded like other drugs and pharmaceuticals, obviously, because they are also coming in contact with your surface of the skin, and from the surface to the systemic circulation. So you have to treat these chemicals as you are treating other drugs and pharmaceuticals for their selection, for their manufacturing. So dental products are also drugs and pharmaceuticals. And if we broadly classify these dental products, they are either anti-caries agent, cleaning agent, polishing agent, abrasive agents. These are sometimes you will get desensitizing agents. You need some desensitizing agents. So these are the dental products, mainly anti-caries, desensitizing, abrasive agent, your cleaning agent, and polishing agent. And now just two or three sentences, we have to know something about the tooth before going into the dental agents. And you have some idea about the a tooth which you have gone through your 11, 12 classes. You know the teeth of the human being, human teeth, are the hardest substance of human body. Besides being essential for chewing, it is not doing the function of chewing only. Teeth also play important role in speech. So teeth is important for our speaking also. If you look into the parts of a tooth, what are the different parts? If you go the innermost part, that is the pulp, which is the softer living inner structure of the teeth, you will find there blood vessels, nerves that will run through the pulp. Over the pulp, there is a layer which is called dentin. It surrounds the pulp cavity and it extends, dentin extends throughout the entire portion of the tooth. That means the portion which is lying inside the gum and the portion which is outside, that is the crown portion, upper, which is you find in the oral cavity. So is dentin remains throughout the tooth. Next is two part. One part is remaining buried under the gum, that is called cementum, the layer of connective tissues that binds the roots of the teeth firmly to the gums and jawbone, that is called cementum. And the dentin part of the tooth which remains outside the gum is being covered by another layer called enamel. So enamel is a white hard material. It covers the portion of the tooth projecting above the gum. Below the gum there is no enamel. Enamel is only upper side of the gum. That part of the tooth is covered with this hardest material known, the enamel. And enamel is actually mostly made of calcium phosphate. So if any person is uh, running through shortage of calcium at a very young age, his enamel will be defective. Enamel formation will be defective. And enamel is the protective layer of your dentin. If dentine is exposed, that will cause sensitization problems and a lot of dental problems will come out. And that is actually happening during dental but teeth decay or dental caries. This dentin, it having 75% mineral, is hard and dense, and the enamel having 98% mineral, and it is even more dense than dentin, and it is the hardest substance which is present in human body. The organic matrix of dentin and cementum both are bone-like. The composition of bone, organic matrix of bone, and dentin and cementum are alike. Vitamin A, vitamin C, vitamin D, these are necessary for the proper tooth formation. So at the younger age, these three vitamins are very important, otherwise improper tooth formation will be resulted. Vitamin A deficiency causes hypoplastic enamel, that is imperfectly calcified enamel. It is called hypoplastic enamel. Hello. হ্যাঁ, গুড মর্নিং, গুড মর্নিং। হ্যাঁ, না কালকে আর যাইনি, তারপরে হ্যাঁ হ্যাঁ হ্যাঁ, আচ্ছা 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 আচ্ছা, আমি ভাবলাম ছুটি তো কালকে যাইনি। ঠিক আছে, আমি পরে ফোন করছি আপনাকে। হ্যাঁ। Now, vitamin C deficiency, it affects calcification of dentin. So, for calcification, proper calcification of dentin, vitamin C is required by our body. And vitamin D not only helps in the absorption of calcium from the GI tract, but it also requires for the proper deposition of calcium and phosphorus in the or over the tooth. Other few ions which are important for the tooth formation and which are present in the tooth, these are magnesium ion, chloride ion, carbonate ion, and citrate ions. They are also important for the proper tooth formation and maintenance of tooth health. Now we will go through as a pharmacist. As a pharmacist, actually, you have to know some terms that will help you to advise patients regarding the problem and the remedies. So, though you are not dentist, but you have to have some idea or some definition of some terms which are mostly used in this dental field before going through the dental products which we have to prepare, which we have to supply in the market for the patients as a pharmacist. Now, abscess. Abscess is a very common term. Abscess অন্য জায়গাতেও হয় তোমরা জানো, but here in the dental area, this abscess is a serious infection, sometimes caused by severe decay. And the symptoms include pain, swelling, and the treatment is the root canal therapy or RCT is required for treatment of this abscess. Many of you know that bleaching, many of you have done probably the bleaching. Bleaching is actually cleaning of your teeth by applying oxidizing agent like hydrogen peroxide solution. It whiten your teeth if it is discolored or if it is stained. So whenever there is stain on the tooth or if it has been discolored, if you apply hydrogen peroxide, it will clean it and it will make it white. The film artists and the dramatists, they have to do bleaching at a regular interval to make their teeth to look their teeth white. Bonding, the process of attaching tooth colored materials to the stained or damaged teeth to restore or improve their color or shape, is called bonding. It has been done by some agents which are applied over the tooth, which are actually tooth colored materials. It covers the stained and damaged teeth, and it appears, it looks the proper or good colored teeth. Bridge, many of you know that bridging has been done to protect the implanted teeth after removing the original teeth, original tooth. It is also known as a fixed bridge. One or more artificial teeth fixed in the mouth by attachments to neighboring teeth, and that is the actually bridging. It has been done by some metals or by some plastic materials, or by amalgamated or by combination of metals, and usually joined by crowns over the tooth on either side of the artificial tooth, sometimes joined with metal extensions bonded to the backs of the neighboring teeth. একটা দাঁত, দুটো দাঁতের মাঝখানে একটা বা দুটো দাঁত বসিয়ে তার উপরে এই ব্রিজিং করা হয়। তার আগে ক্রাউন বসিয়ে দেওয়া হয় যেটা ইমপ্লান্টেড টুথ, এবং তারপরে এই ব্রিজিং করে দেওয়া হয় টু গিভ দি পার্মানেন্ট পার্মানেন্সি অফ দি ইমপ্লান্টেড টিথ, আদারওয়াইজ এটা ওখানে উঠে যাবে। সেই জন্য দুটো বাকি যে দু তিনটে দাঁত দুপাশে রয়েছে তার সঙ্গে এটা কানেক্ট করে দেওয়া হয়। দ্যাট ইজ কল্ড ব্রিজ। ক্রাউন, এটা হচ্ছে জানো দাঁতের উপর যে টুপিটা বসিয়ে দেওয়া হয় মেটালিক, যেটা আমরা ইমপ্ল্যান্ট করলাম, বা যেটা আমার অরিজিনাল টুথ ইজ দেয়ার বাট সামহাউ ইট হ্যাজ বিন ডিকেড অর ইট হ্যাজ বিন ইনফেক্টেড, ইট হ্যাজ বিন সেন্সিটাইজড। তখন আমরা কি করি? রুট ক্যানাল থেরাপি করি, রুট ক্যানাল ট্রিটমেন্ট করি। ভেতরের নার্ভগুলোকে রুট ক্যানাল ট্রিটমেন্টে কি করা হয়? পাল্পে পৌঁছে যায় ডাক্তার দাঁতেটার ফুটো করে, ডেন্টিনকে ফুটো করে উইথ ইনস্ট্রুমেন্ট, এবং পাল্পে গিয়ে নার্ভগুলোকে মেরে ফেলা হয়। ইফ দেয়ার ইজ নো নার্ভ দেয়ার উইল বি নো সেন্সেশন ডিউ টু দি damaged enamel, due to the damage connectivity near the gum. What happens? Your dentin being exposed, so hot and cold, acid, these things will come in contact with dentin and it will give sensitization. It will go to the nerve and you will feel pain. So to remove this discomfort, RCT has been done, that is the root canal therapy. কি করা হয় সেখানে না, ডেন্টিনকে ফুটো করে পৌঁছে যাওয়া হয় পাল্পে। পাল্পের মধ্যে নার্ভ অ্যান্ড ব্লাড ভেসেলস আছে তোমাদের বলেছি, সো দ্যাট নার্ভগুলোকে মেরে ফেলা হয় যাতে করে ওই দাঁতটার মধ্যে আর কোনো নার্ভ কানেক্টিভিটি না থাকে। ইফ দের ইজ নো নার্ভ ইউ উইল নট ফিল এনি acid or any hot and cold, so sensitization will gone, and that is the main purpose of RCT. And after doing RCT, তোমার এই ডেন্টিনটা তো এক্সপোজড হয়ে আছে, সো টু প্রোটেক্ট ইট তোমাকে কি করতে হবে? ইউ হ্যাভ টু কভার দি টুথ বাই ক্রাউন and then by cement, artificial cement, you block the crown with the gum such that কোনো বাইরের অ্যাসিড or other food material ওখানে এন্টার না করে, and that is called cap also. It is an artificial cover for a decayed or damaged tooth. It is made of plastic or metal, porcelain, or a combination of metal and porcelain. So this is crown. Feeling, these are the material used to fill a cavity. Sometimes in your teeth cavities has been formed, so the ওই ক্যাভিটির মধ্যে the food particle, the acids and other things may enter and give you pain and other sensations. So what is the treatment here? To filling the cavity with some dental material, dental product which are required for filling material, and it is composed of mixture of metals, that is the amalgam, plastic, porcelain or gold, something gold দিয়েও করা হয়. Another term which you have to come through, impacted tooth. It is an unexposed tooth in the jaw that cannot reach its normal position and is confined beneath the gum surface. অনেক সময় হয় দাঁতটা ঠিক বেরোয়নি, দাঁতটা প্যারালালি গামের মধ্যেই রয়ে গেছে, impacted tooth. It is not being exposed. It remains in the jaw. তখন ডেন্টিস্টদের এটাকে সার্জারি করে বার করতে হয়, অথবা যদি দেখা যায় যে এটার কন্ডিশন ইজ ওটাকে এক্সপোজ করাই যাবে না, they remove it. Anyway, this condition is called impacted tooth. এছাড়াও তিনটে টার্ম ডেন্টিস্টদের বিষয়ে খুব শুনবে, একটা হচ্ছে অর্থোডন্টিক স্পেশালিস্ট শুনবে না। অর্থোডন্টিক ট্রিটমেন্টটা কি? It is a method of correcting the position of teeth using braces or similar devices. অনেক সময় দেখবে অনেক ছেলে বা মেয়ের একটা তারের মতো জিনিস দাঁতে লাগিয়ে দেওয়া হয়, ব্রেসেস, টু কারেক্ট দ্য পজিশন অফ দ্য টিথ। টিথ কারো হয়তো বাইরে বেরিয়ে আসছে কোনো টুথ, বা একটু উঁচু আছে দাঁত, বা অন্য কারণে একটা দাঁতের উপর আরেকটা দাঁত উঠে গেছে। টু কারেক্ট দ্য পজিশন, it has been done by the orthodontists, and this is orthodontic treatment. ডেন্টিস্টদের যে স্পেশালাইজেশন রয়েছে তার মধ্যে একটা হচ্ছে অর্থোডন্টিক পার্ট, দ্যাট sees the cosmetic part of the teeth. Periodontitis, it is the advanced stage of gum disease. It is titis যখন তখনই বুঝবে it is inflammation. আমরা অন্য জায়গাতে যখন পড়বো ফিজিওলজিতে দেখবে it is called inflammation. So when the inflammation is at the gum, or it is a gum disease, then it is called periodontitis, and leading cause of tooth loss among adults. Adultsদের tooth lossের বড় কারণ this periodontitis. The gums and tissues are inflamed, ফুলে যায়. Plaque gets into pockets below the gum line. যে প্লেকটা আমরা জানি যে দাঁতের উপরে হয়, একটা ইয়েলো স্টেইন পরে, that plaque will go then inside the gum line এর নিচে নেমে যাবে, ভেতরে যাবে, tooth roots become exposed. As gumটা লুজ হয়ে গেছে, tooth root will be exposed, and the supporting bone that is destroyed. Then what will be the result? It will cause tooth loss. The symptoms that include gum separating from teeth, sifting or loose teeth, দাঁতটা নড়ছে, bad breath, or bad taste in the mouth. These are the symptoms. From that symptoms, you can think of this periodontitis. You may go to a dentist to finally check your teeth to see that whether there is any periodontitis condition is or not. Root canal therapy is also called endodontics. Orthodontics, it is endodontics. That is related with the root canal inside the pulp within the gum, and the cleaning out and filling of the innermost part of the tooth, that is known as the pulp, and that has been damaged or severely decayed. If it has been decayed or damaged, then this filling, this cleaning, that has been done by the root canal therapy. Scaling, তোমরা সবাই শুনেছো, time to time অনেকে স্কেলিং করায়. It is good for dental health. It is the removal of tartar. Tartar is the second condition of plaque. Plaque প্রথমে হয়, plaque আরো solidified হতে হতে আরো deposition পড়তে পড়তে যে কন্ডিশনটা আসে, that is called tartar. It is the hard yellowish substance that forms on the teeth and causes them to decay. It causes the decay of the teeth from the teeth above and below the gum line, and it must be done by a dental professional. The scaling should be done by a dental professional, otherwise teeth নষ্ট হয়ে যাবে. Now, dental products, আমরা যাওয়ার আগে একটুখানি দেখি যেটাও তোমাদের জানা, যে what are the different types of teeth? You have 32 teeth in an adult, in a human being. out of these 8 are incisors. Incisors যেটা middle portion এ থাকে, উপরে 4টে নিচে 4টে। উপরের jaw, upper jaw contains 4 incisors and lower jaw contains 4 incisors. And then on both sides of the incisors there are canines, which total number is 4. Left side of the upper incisor there is 1 canine, and right side of 1 canine. Then lower jaw teo, left side and right side there will be total 4 canines. Then there is premolars. How many premolars we have? 8 premolars. Both sided. যদি আপার জয়ে যাও তাহলে ক্যানাইনের পাশে, লেফট সাইড ক্যানাইনের পাশে দুটো, রাইট সাইড ক্যানাইনের পাশে দুটো। সিমিলারলি ইন দ্য লোয়ার জ, লেফট সাইড ক্যানাইনের পাশে দুটো and right side canine পাশে দুটো. So total 8 premolars teeth are there, which are lying between the molars and canine. Then finally the molars, it is also 8. Similarly 2 2 and 2 2, left right upper and lower jaw. Then there will be 4 wisdom teeth. One in the upper side of the upper jaw, right side of the upper jaw, one in the left side of the upper jaw, one in the left side of the lower jaw and right side of the lower jaw. This total 4 wisdom teeth, and these teeth are also called third molars. Other than wisdom teeth, generally all teeth are erupted by the age of 13 maximum, and the wisdom teeth after 18 years. The crown, which part is the crown? The teeth which projects inside the mouth. That is the crown. Now we're coming, what are the dental products? Dental products are mainly used for treating and or cleaning the teeth. One thing is you have to treat the condition, and another, if it is nothing has happened, cleaning is very important. So you have to clean your teeth. That is most important part for the oral health. So dental products, they include Dentifice. What is a Dentifice? A Dentifice is a substance used with a toothbrush for the purpose of cleaning, like our toothpaste that we are using daily. It is the Dentifice. It contains the Dentifice. So we use it with our toothbrush for the purpose of cleaning the accessible surface of the teeth. Commercial dentifrices are available in the form of pastes and powders. Now, what are the chemicals? What are the pharmaceuticals that are considered as dentifrice? Calcium phosphate, dibasic and tribasic calcium phosphate, calcium carbonate, sodium metaphosphate. These are dentifrice. Now, what second kind of dental product is abrasive. Abrasive মানে বুঝতে পারছো যে এটা একটা ঘষা দিয়ে তুলবে. So dentifrice is also like that, but it is very mild. But abrasive is very hard and very rough. And abrasive is only used by the dentist, not by general people. They have to use it in sometimes. These preparations are used by the dentist in cleaning and polishing teeth. They are used to facilitate the mechanical removal of dental plaque, dental debris or dental stains from the tooth surface. Hydrated silica, pumice, these are some of the abrasive agents are being used in dental products. Anti-caries agent. Now, what is caries? Dental caries or tooth decay, it is more or less a disease of the teeth, and it is caused by acids produced by the action of microorganisms on carbohydrates. You are taking the food which contain carbohydrates, which some part of the carbohydrate may remain in the dental cavities, dental gaps in your mouth, that has been acted by microorganisms present in your oral cavity, and this microorganism, when they are taking food from these carbohydrates, they produces acids as byproduct. These acids, maybe lactic acid, these acids are the reason for the dental caries or dental decay. This disease is characterized by decalcification of tooth accompanied by foul mouth odor. They causes decalcification. This acid actually decalcified the enamel, and for this there will be surely foul mouth odor, বাজে একটা গন্ধ মুখ থেকে বেরোবে whenever there is caries or tooth decay. The exact cause and mechanism of dental caries is not known with certainty. However, it is accepted that dental caries first of all starts on the surface of the teeth. Acids produced by this bacterial metabolism of fermenting carbohydrates act on teeth, produce lesions, and in these lesions, bacteria get entered into a localized there in the teeth, and this ultimately leads or increase the dental decay or tooth decay. So what we have to do for prevention, to prevent dental caries and to maintain clean and healthy teeth, it becomes necessary to use dentifrices, because you know that dentifrices regularly clean if there remains any food particle, and if it can remove the food particles from the surface of the teeth, from the gaps of the teeth, it will minimize the action of the bacteria. Food Bacteria on food, bacteria will not get the carbohydrate inside the mouth, so the action will not be there, so acid will not be produced, and it can maintain the tooth health by preventing the dental decay or dental caries. So primary function of the dentifrice is to clean the accessible surface of the teeth, and there are substances having known therapeutic value. Sometimes some substances are being added with the dentifrice which have some therapeutic value. Use of ammoniated toothpaste, urea ammonia containing powders, antibiotic containing mixtures, anti-enzyme compounds, they are also have been used nowadays. And these compounds are having their advantages, and also they have the limitations also. Now, one thing is here you see that in case of anti-caries agent, means a drug that aids in the prevention and also prophylactic treatment of the dental caries, dental decays. And what are the common agents? They are sodium fluoride, stannous fluoride. Now, fluoride is common in both the compound. Why? The role of fluoride in preventing dental caries has been well accepted. Administration of traces of fluoride or fluoride salts in topical use to the teeth, it has been reported to give encouraging results. Fluoride ion is a trace material, you know, that present in our body, and it is generally adequately obtained from the food and from the water, especially from the drinking water. But in some parts of the world, you know that some of the fluorides we are getting from our salts, some of the fluorides we should get from drinking water, but some parts of the world, groundwater is totally lacking fluoride. And also, I know that there are some parts, even in our state also, there are excessive fluorides are there in some parts of Birbhum district. So that causes another thing, another problem. Anyway, if it is lacking fluoride in such places, occurrence of dental caries has been observed in alarming ratio. So then it has been experimentally, it has been statistically found out that. Hello? Any question? Hello? Addition of fluoride to the municipal mute করো তোমাদের. Addition of fluoride to the municipal water supply is known as fluoridation. Not fluorination, it is fluoridation. Is fluoridation done to help and preventing dental caries? So fluorides ultimately find use in dental practice. It has been observed experimentally that this fluoride, if present in limiting concentration, not more, we requires 1 ppm. But if it is more than 1.5 ppm, it again toxic for us. So 1 ppm fluoride, if remains, if we get it, then it is observed that it is helpful to prevent dental caries or tooth decay. And whenever it is not available in the source of in the drinking water or in your salt, it is observed that in that place, in a much higher rate, dental caries or tooth decay is being resulted. So from that, we come to know that fluoride ion is very essential to maintain the tooth health, and it is also required for our bones. And we know that the basic structure, some ions which are present in bones and in tooth, they are common. So it is possible to administer fluoride in two routes, orally as well as topically. The use of fluoridation of public water supply has been the most common and effective way of oral administration. And water supply containing 0.5 to 1 parts per million is today provided, which is found to be sufficient to prevent the caries. Alternatively, it can be given in drinking water or fruit juice in such a concentration to have 1 ppm per day that can be given to your water in your house for the particular patients. Sodium fluoride tablets and solution of sodium fluoride 2.2 milligram per day are also being used for such patients who are being treated for the dental caries. For topical application, if you want to apply over the teeth, a 2% solution of this fluoride are being used. Besides fluoride, another thing, you know that phosphate, calcium phosphate is required for the formation of your enamel. So inorganic phosphate salts are also being found to be useful in reducing the dental caries and to maintain the dental health. And the phosphate ions are needed for stronger bones also for a healthy adult. So for both stronger teeth and stronger bones, phosphate is also again a very important ion. And the phosphate salts, both in soluble and insoluble forms, must be present in the normal diet. The phosphates are normally given in deficiencies if it is observed that there is deficiency. Otherwise, you need not take phosphates as such because it is being supplied in appropriate amount from the normal diet to you. But if it is observed that in some person there is deficiency, then we have to supply phosphate for maintaining the tooth health and also for maintaining the healthy bone. Now we will be going to some of the specialists who are in the practice of dental health. And sometimes you have come through these terms also, endodontist. Who are endodontists? They are specialized dentists in a root canal therapy. So the dentists who have done the specialization in the root canal or in the treatment involving damaged pulp, that means inside the tooth, that is the innermost part.
স্যার
Yeah,
বলছি যে স্যার ডেন্টাল প্রোডাক্টসের ওই স্লাইডটাই শো করছে ওই অ্যান্টি ক্যারিজ
আমি
অ্যাপসার।
পরে দেবো, স্লাইড পরে দেবো।
আচ্ছা
শুনে নাও।
আচ্ছা
They are called endodontist. Endodontist means jara, those doctors, those dentists who have done their specialization in the inner part of the tooth, that is the root canal, the pulp, and they have the idea of that part. They are called endodontist. Orthodontist, they have the specialization about the correct position of tooth, and they are actually doing this cosmetic uh, part of the teeth. It's looking, its position that has been corrected by orthodontists. Pediatric dentists are there. They have done the specialization in treating dental needs of children. What foods should be given to them to get proper uh, tooth, healthy tooth. Periodontist is another. So endodontist, orthodontist, and periodontist. Periodontist is diseases of the gums and the tissues that surround the teeth. টিথটা ধরে রেখেছে যে গামটা, এই গামের পার্টটাকে নিয়ে যারা স্পেশালাইজেশন করেছে, দে আর পেরিওডন্টিস্ট। সো তিনটে পার্ট খুব ভালো করে আগে মনে রাখো। একটা হচ্ছে পেরিওডন্টিস্ট, দ্যাট ইজ দি গাম পার্ট। যেটা ওপরের ক্রাউনটাকে নিয়ে দেখছে, দ্যাট ইজ অর্থোডন্টিস্ট। যারা রুট ক্যানাল বা পাল্প নিয়ে ট্রিটমেন্ট করছে, দে আর এন্ডোডন্টিস্ট। অ্যান্ড পেডিয়াট্রিকের জন্য পেডিয়াট্রিক ডন্টিস্ট। অ্যান্ড অ্যানাদার থিং হচ্ছে ওরাল অ্যান্ড ম্যাক্সিলোফেসিয়াল সার্জন, যারা আমাদের এই দাঁত অ্যাক্সিডেন্ট হয়ে ভেঙে গেছে, টোটাল পার্টটাকে আবার সুন্দরভাবে সেট করতে হবে। দ্য এক্সট্রাক্টস টিথ, সার্জিক্যালি ট্রিটস ডিজিজেস, ইনজুরিজ অ্যান্ড ডিফেক্টস অফ দি জ অ্যান্ড দ্য মাউথ। দে আর দি ওরাল অ্যান্ড ম্যাক্সিলোফেসিয়াল সার্জন। অ্যান্ড প্রস্থোডন্টিস্ট হচ্ছে ফর the proper treatment, proper cosmetics purpose, for all these things, you have to give some artificial teeth sometimes. কিছু টিথ নষ্ট হয়ে যাবে, কিছু টিথ তুলে ফেলতে হবে। So those dentists who have done their specialization in artificial devices for the mouth, such as dentures, bridges, implants, they are called prosthodontists. So these are the different type of dental surgeons who are, and as pharmacists, hoito, you have to come through this. You have to have the knowledge of these terms to help or to advise the patients. That is why we are discussing these things. As far as dental products, here I have given in the slide what is dentifrice, what are the examples of dentifrice, what are abrasive, what are the abrasive agents mostly used, what are anti-caries agent, that is sodium fluoride and stannous fluoride, that is mostly used. Other than these three, there are some other dental products which I have told you just now. Desensitizers, তোমরা সবাই জানো সেন্সিটাইজড হয়ে যায় গরমে ঠান্ডায়, দাঁত সিরসির করে, কোনো খাবার এলে গন্ডগোল হয়ে যায়, পেইন। So desensitizers are required to treat those sensitization conditions. The decrease, they actually, what they do, these desensitizers, they actually decrease the hypersensitivity of the teeth. How? When these desensitizers are applied over the surface of the teeth, especially the area, the portion where the erosion has occurred, and it is generally near the gum line. You know that through the gum line, actually this temperature change, acid, food particles, they enter into the pulp where the nerve endings are there, and then it causes this sensitization and a problem arises. So they have to cover, desensitize the gum line area. And the examples of this desensitizer solution agents are ammoniacal silver nitrate solution. আমি দেবো তোমাদের নোট, চিন্তা নেই। Ammoniacal silver nitrate solution, formaldehyde solution, liquefied phenol, and oh no, এটা তো নোট ছিল, আমি খেয়াল করেছি। So yes, you have the notes here. Desensitizers, they decrease hypersensitivity of the teeth when applied to their outer surface, especially where erosion has occurred near the gum line. সোহাইলি দেখতে পাচ্ছ?
হ্যাঁ স্যার দেখা যাচ্ছে।
আমি খেয়াল করেছি। And the examples of these desensitizers are ammoniacal silver nitrate solution, formaldehyde solution, liquefied phenol, zinc chloride solution, and even 10% sodium chloride. If you give in the form of toothpaste, it also gives desensitization of the hypersensitive teeth. So these are the desensitizers. Another two minor dental products are also available. That is cavity liners. These cavity liners are used to seal the dental tubuli. সিল করবার জন্য আমাদের একটা এজেন্ট লাগে, এটা ডেন্টিস্টদের দিতে হয়। তোমরা এই টার্মটা শুনে থাকবে অনেক সময় যে সিল করে দেওয়া হলো ক্যাভিটিকে। সো ডেন্টাল টিবিউলি কোথাও এক্সপোজড হয়েছে, তৈরি হয়ে গেছে টিবিউলি, টু সিল ইট উই হ্যাভ টু গিভ ক্যাভিটি লাইনার্স, and that has been prepared. They actually contain dental cements, and we have to prepare dental cements to supply the dentists from our pharmaceutical manufacturing units. And another thing that is also required sometimes for dental treatment, that is the analgesic, alveolar analgesics. They are employed by the dentist for the symptomatic relief of pain arising from post-extraction alveolitis. Extract করা হয়েছে, dry socket তৈরি হয়েছে, so you have to give some local anesthetics such that painটা তারা feel না করে. It is actually analgesics, pain healer. So these local anesthetics, it is common. যেমন আমরা benzocaine দিন আমাদের বডিতে অন্য জায়গায় লোকাল অ্যানেস্থেসিয়ার জন্য। So benzocaine, or sometimes তোমরা জানো বাড়িতেও অনেকে ব্যবহার করে থাকবে যে আমরা ক্লোভ অয়েল ইউজ করি, দাঁতের ব্যথা হচ্ছে ক্লোভ অয়েল, or guaiacol. These things are also being used as analgesics for these exposed sockets. And mouthwashes are common for the oral health, and we are giving these mouthwashes for like dentifrices we are using paste and powders, but mouthwash is also required. Cleaning is done by three ways. Cleaning, you cannot clean your teeth only by brass, especially if there is variable gaps between the teeth is found, then you have to use dental floss. আমি জানি না তোমরা ডেন্টাল ফ্লস দেখেছো কেউ? হ্যালো, ডেন্টাল ফ্লস
না স্যার।
এটা একটা সুতো, প্লাস্টিকের সুতো। দেখবে যদি কারোর দাঁতে প্রবলেম থাকে, কোনো ডেন্টিস্টের কাছে যাও বা মুখে খুব ব্যাড ওডার হচ্ছে যাও, ডেন্টাল ফ্লস দেওয়া হয়। ডেন্টাল ফ্লস একটা সুতোর মতো জিনিস, তোমাকে প্রত্যেকটা খুব ভেরি ফাইন সুতো, বাট খুব শক্ত আর কি, প্রত্যেকটা দাঁতের গ্যাপের মধ্যে তোমাকে ঢুকিয়ে বার করতে হবে, টু ক্লিন দ্য গ্যাপস বিটুইন দ্য টুথ, প্রত্যেকটা গ্যাপসকে ক্লিন করার জন্য। দিস ফ্লসিং ইজ বিং ডান. It is very important treatment. So for cleaning, our regular cleaning of our teeth, dentifrices দিচ্ছি আমরা, পেস্ট করছি, পেস্ট বা পাউডার দিয়ে আমরা ব্রাশিং করছি। ডেন্টাল ফ্লস ইজ রিকোয়ার্ড বিকজ আমাদের ব্রাশিং ইনসাইড অফ দি টুথ থেকে সব পার্টিকেলস বার করতে পারে না। অ্যান্ড দ্য থার্ড ইজ আমরা মাউথ ওয়াশ করি, এটাও দেওয়া হয়, দেখবে যাদের খুব প্রবলেম হচ্ছে, ব্যাড ওডার হচ্ছে, ডাক্তাররা প্রথমে দেন। So we have to prepare and supply this mouthwashes also. We have to make available these products for the treatment of the patients. Mouthwash কি করে, অর্গানিজমকে যদি আমরা ওখানে কিল করে দিই, organisms will act on the food particle to produce acid for which is responsible for the tooth decay. তাই না? সো যদি অর্গানিজমকে আমি ওখানটাতে কিল করে রাখি, যদিও আমরা জানি there are lot of beneficial microorganisms present inside our oral cavity, present inside our gut, they are required for us, they produces vitamin. তুমি দেখবে যে আমরা আমরা যখন অ্যান্টিবায়োটিক খাই তারপরে কি বলি, ভিটামিন খেতে হবে। কেন বলি? বিকজ অ্যান্টিবায়োটিক which kills the microorganisms, we have some good microorganisms inside our stomach, intestine, those microorganisms are also being killed by the antibiotic tablet or antibiotic injections. তাহলে অনেকেই আছে যারা বডিতে আমাদের তৈরি করে ভিটামিন, ভিটামিন বি কমপ্লেক্স তৈরি করে, B12 তৈরি করে, আমি তখন এগুলোকে পাবো না, তার জন্য আমরা তখন বাইরে থেকে নিই। and the flora of this microbial organismটা নষ্ট হয়ে যায় যখন আমরা অ্যান্টিবায়োটিক প্রোডাক্ট নিই সিস্টেম্যাটিক্যালি, তখন আমরা সেই ফ্লোরাটা নষ্ট হয়ে যাওয়ার জন্য দেখবে অনেকের ক্ষেত্রে ডায়রিয়া কন্ডিশন এসে যায় অ্যান্টিবায়োটিক ইউজ করে। সো আমরা তখন কি করি, আমরা আজকাল ল্যাক্টোব্যাসিলাস নিই, ল্যাক্টোব্যাসিলাস দিয়ে দেওয়া হয় ট্যাবলেটের সঙ্গে, অ্যামক্সিসিলিন উইথ ল্যাক্টোব্যাসিলাস, যাতে করে গুড ব্যাকটেরিয়াল, গুড মাইক্রো অর্গানিজমের ফ্লোরাটা মেনটেন করা যায়। অ্যান্ড অলসো উই টেক ভিটামিন, যে ভিটামিনটা আমার বডিতে মাইক্রো অর্গানিজম তৈরি করতো সেটা পারে না বলে। সিমিলারলি ওরাল ক্যাভিটিতেও কিন্তু যখন আমাকে ট্রিটমেন্ট করতে হবে, এমন কন্ডিশন হয়েছে যে তার হয় ইনফ্লামেশন হয়েছে, ইনফেকশন হয়েছে, মাইক্রো অর্গানিজমের ওখানটাতে অনেক গ্রোথ হয়ে গেছে, অর মাইক্রো অর্গানিজম প্রচুর ডিকে করছে, তো উই হ্যাভ টু কিল সবাইকে উইদাউট কোনো স্পেশালি কাকে তো আমরা আলাদা করে করতে পারবো না। সো উই হ্যাভ টু টেক দিস মাউথ ওয়াশেস, দে আর মেডিকেটেড লিকুইডস, ইউ নো দ্যাট মাউথ ওয়াশেস আর মেডিকেটেড liquids and they are mainly antiseptics used for cleaning the mouth or treating affected mucous membranes if these mucous membranes are being infected. So these are also medical dental products which you have to use during your oral hygiene. So oral hygiene does not simply imply the mere cleaning of teeth, it also means the prevention of tooth decay. Brushing of teeth regularly is necessary to remove any material particles from the tooth surface before it hardens, before it forms into calculus. Because a smooth surface and brushing prevents adherence of food particles. If that is not smooth, rough surface with tomar teeth er opor thake, so that part of the food, small food particles will deposit. And not only food particles, it also deposit bacteria. So ultimately there will be bacterial action. And for that reason, fluoride in low concentration in drinking water, that is also a method of prevention. You have to use dentifrice, you have to use floss if required, if you have to use mouthwash if required. But other than requirement for prevention, you have to take fluoride in low concentration. Fluoride present in low concentration in your drinking water, in your salt, it will surely prevent the enamel damage. এনামেল ড্যামেজকে প্রিভেন্ট করবে, সো ক্যারিজ হবে না। যদি সেখানে অ্যাসিড থাকে তবু it will help nullify the action of the acid. So taking of fluorine is necessary in that case. And it also help decrease the solubility of the enamel. So today this part is general part of this dental products, and we have 8 or 9 dental products that we will finish in the next class. These agents, the names which we have discussed today, each and every one in the same way, the use, preparation, and their preservation, that will be discussed. Okay.